Hello, I'm Bruce Hillman, Editor-in-Chief of the Journal of the American College of Radiology. Welcome to the JACR Roundtable on Radiation Dose Optimization. This presentation that you're watching is part of a website. This website is sponsored by GE Healthcare and opened in late December of 2012. On the site, you'll find important publications dealing with radiation dose, as well as a number of important links and also multimedia presentations like this one today. We are doing this for several rationales. First of all, we wanted to increase recognition of the concerns that have arisen dealing with the growing use of CT and the growing radiation dose to the population. Secondly, we want to provide a resource for professionals and the lay public that provides balanced and accurate information. And finally, ACR, the American College of Radiology, and its journal JACR are heavily invested in this field. We want to continue to make that investment more and more important. When we talk about low-dose diagnostic radiation, we're talking about two main levels of effect. One is the so-called non-stochastic or deterministic effects, and these occur almost immediately following a larger than normal dose of radiation. This kills cells and the effects are almost immediately evident. The second level is referred to as stochastic or delayed effects. These effects are related to the action of ionizing radiation on cells. And there may be, as part of this late action, even 10, 15, 20 years later, an effect that causes cancer. As you can see from this slide, things have changed very dramatically since 1982. Indeed, whereas background formerly was by far more than 80% of all the radiation, the dose in the current era of radiation received from medical examinations has increased dramatically, six-fold in fact, relative to 1982. Looking at the slices of this pie chart, it is evident that most of the radiation is coming from increased use of computed tomography. There's also a great deal from nuclear medicine procedures. This next slide drills down into CT, and you can see that despite the rumors of a flattening of the use of medical imaging over the last 3 to 4 years, that in fact CT use continues to rise. One important change has been the increasing use of CT in the emergency room, where sometimes this technology is being used actually to triage patients. Collectively, dose to the population then is rising, and this is a growing concern because of the possibility of almost epidemic cancer sometime in the distant future. We can't really be sure of this, and indeed this is what our panelists will discuss today. A CT scan is roughly 100 times the dose of a chest X-ray, and you can see where per individual or per population this would be a very important difference. CT is growing because of the increasing indications for its use in the medical literature. In fact, it is more available than it's ever been. The manufacturers have been very good at developing technologies that can be placed in office practices, push-button operations so that these kinds of offices can actually apply the technology, but with concerns over what they may actually know about its use or the potential risks. And then, of course, it's faster than ever before, allowing for certain kinds of procedures that couldn't be performed in the past, like CT coronary angiography and CT colonography. With all of this in mind, we have a number of goals for this, our JACR Dose Optimization Roundtable. We want to solicit expert opinions based on the information that we have available to us at this time. We want to illuminate the controversies surrounding the health effects of diagnostic radiation, and we want to emphasize the most important thing, which is really what benefit is obtained from obtaining a CT scan or another diagnostic radiology examination against what small risks are posed in the distant future. We've assembled this remarkable panel of luminaries, and indeed, such a collection of intellect has not existed since Thomas Jefferson dined alone. The order of presentation is first, we'll hear from David Brenner about the radiation risk associated with CT scanning. Next, Dr. Ella Kazaruni, talking about reducing unnecessary, inappropriate, and uncritical examinations. Dr. Stephen Birnbaum will follow, talking to us about lowering the dose while maintaining image quality in a community practice. And wrapping it up will be Dr. Richard Morin on quality assurance, dose reporting, and regulation. Each will have a short period of time to present just an outline, really, the most important things dealing with their subject. The real thing will be the discussion that will follow.